Hello and welcome, everyone. Thank you so much for joining us today. We're really looking forward to today's program. Hi and welcome, everyone. The presentations that you'll be hearing today were part of a concurrent session at the 2024 ACS NCCRT Annual Meeting last November. And when we asked attendees which session that they'd like to see in a virtual format, the overwhelming response pointed to this session. And the timing is right. As we know, many of you are looking for new ideas to spread the word about colorectal cancer screening leading up to March, which is Colorectal Cancer Awareness Month. Next slide. So the purpose of today's webinar is for you to learn about 4 organizations' innovative public awareness strategies to promote colorectal cancer screening in the communities they serve, to highlight ACS NCCRT's suite of communications resources and additional tools that can support you in your colorectal cancer public awareness efforts, and for you to learn about opportunities to share about your own work leading up to March. The presentation portion of this session is being recorded, and the video recording and slides will be posted to our website following today's presentation. We'll have time for questions at the end, so please submit your questions in the Q&A box throughout the program. And finally, we'd greatly appreciate it if you would take a couple minutes to complete the evaluation at the end of today's webinar. Next slide. I'm pleased to introduce you to our speakers on today's program. We have Mark Kennedy of the Boston Public Health Commission, Dr. Nathan Merriman of Intermountain Health, David Russo of Cheeky Charity, and Jamie Thompson of the Kaiser Permanente Center for Health Research. Next slide. And before we hand it off to our first speaker, we wanted to share with you a few resources and tools to support your colorectal cancer public awareness efforts. So here you'll see, over the years, we've created a number of resources to support your colorectal cancer messaging by conducting market research with adults who are either unscreened or not up to date with their colorectal cancer screening. Our first market research began in 2014 following the Affordable Care Act, as we knew there were suddenly thousands of people that had access to insurance that didn't before, and we wanted to know what messages would resonate with them in convincing them to get screened for colorectal cancer. So we have a few sort of general messaging guidebooks that we've created over the years, as well as a few companion guides focusing on particular populations, such as Hispanics, Latinos, Asian Americans, Black and African Americans. And then just last year, we published our latest guidebook, which is the Lead Time Messaging Guidebook, which is aimed at reaching people before they reach screening age at 45 and getting them primed to get screened right on time. Next slide. And additionally, our Tailoring Colorectal Cancer Screening Messaging Guidebook focuses on tailoring messaging to communities hardest to reach through a step-by-step process and practical tips. It's targeted at cancer coalitions, but the guidance is relevant to any type of organization seeking guidance on fine-tuning their colorectal cancer screening messages. And while not directly related to public awareness, we wanted to also bring your attention to our newest resource update, the Clinician's Reference on Stool-Based Tests for Colorectal Cancer Screening, which makes the case to primary care clinicians to offer the menu of screening test options to patients and seeks to dispel the myth that colonoscopy is the gold standard. Next slide. And lastly, we wanted to share with you the 5 areas of focus that our steering committee developed to guide our work to reduce mortality and mortality disparities related to colorectal cancer, in addition to prevention and early detection. You'll see here that we have a core focus around screening, but we're also working to increase timely action for early age onset colorectal cancer signs and symptoms, as well as timely referral to treatment. But I wanted to bring your attention to the presentations that you'll hear today include a common thread of focus on colorectal cancer health equity, and promoting colorectal cancer health equity has been an official priority for us for several years, and we remain steadfastly committed to work in this area. So you'll see that as number 1 in this list here. And in the chat, you'll find a link to a recent blog post where you can learn more about our work across these areas. All right, and now with that, I'm pleased to pass the baton to Mark Kennedy, who will share with us about his work through the Boston Public Health Commission. Thank you, Mark. And Mark, you are on mute. You're still on mute. Let's see.
Yeah, I should be off mute now, right?
Okay, excellent. Thank you so much. Take it away.
No problem. All right, let me get my presentation back here. Okay. Again, my name is Mark Kennedy. I'm with the Boston Public Health Commission. I'm here to talk about our colorectal cancer screening communications campaign. Next slide, please. The Boston Public Health Commission is the nation's first health department. Our mission is to work in partnership with communities to protect and promote the health and well-being of all Boston residents, especially those impacted by racism and systemic inequities. Next slide, please. Black men in Boston die from colorectal cancer twice as often as white men. And Black women in Boston have a mortality rate that is 70% higher than their white counterparts. We also know that colorectal cancer is among the top causes of mortality from screenable cancers for Latino residents in Boston, and that overall, people younger than age 40 are steadily becoming a larger percentage of new cases of colorectal cancer and are frequently diagnosed at late stages. Nationally, Latinos represent the fastest growing group in this category. Last, our BRFSS data show the colorectal cancer screening rate for Boston overall at 43.9% with colonoscopy for adults 50 plus years of age in years 2017, 2019, and 2021 combined. Of course, this is before the guideline change to start at 45. Next slide, please. With our campaign, we focused on these 6 neighborhoods where residents bear the biggest burden according to our data. Next slide, please. We started by talking with people in these neighborhoods to try to get an idea of how to design the campaign to get the maximum response to the call to action component of the campaign. Next slide, please. A couple of things to highlight here. Preventive care turns out to be a new concept for many of our non-English speaking immigrant population. But as people presenting with colon cancer are becoming increasingly younger, we realize that young residents in general would need to be more oriented to preventive care as well. Next slide, please. In our selection of champions to carry our message to our priority communities, we chose a male and a female leader that have built long-standing relationships, reputations, and trust in each of our priority communities. And we included a GI specialist to disseminate medical information. Next slide, please. We launched this campaign in 2 phases. The first phase launched in September of 2022, largely in our transit system, using the bus and train lines that our priority populations typically use to commute to work every day. Because of social cognitive theory, our tagline was about screening for those we love. I got screened for him, her, them, and we used stock photos representing social situations that people could resonate to. You're looking here at an example of I got screened for him. Next slide, please. Here are some of the other examples. On the left, I got screened for her, and on the right, I got screened for them. Next slide, please. These are samples of the posters that feature the 6 champions in the campaign. So we moved away from stock photos for our phase 2. Next slide, please. Phase 2 launched on March 1st of 2024 with a full rollout the following Monday on March 4th. We increased the number of bus shelters that we used from 30 in phase 1 to 40 in phase 2. Next slide, please. We also produced videos as well, and here's one of them.
Tu salud es el primer paso en poder ayudar a tu familia.
Tu salud es el primer paso en poder ayudar a tu familia.
As immigrants,
All of the things that we strive for as Latinos, as immigrants, security for our families, education for our kids, a better life. Todo depende de tu salud. As a community, we tend to push our personal health aside, leading to symptoms going unnoticed or overlooked. But without your health, it's impossible to provide a better life for your family. Know where you stand with your body and get tested. The right resources are out there for you. Spanish-speaking providers, professional support, and even home testing options. Todo depende de tu salud.
For more information about colon cancer, signs and symptoms, family history, and your screening options, please visit boston.gov/cancer.
Next slide, please. So in terms of assets, we produced a total of 7 videos, 6 featuring our champions and 1 featuring our medical advisor. These videos are intended to be shown at health center and hospital waiting rooms, online in channels like YouTube, and of course our own website with our CBO partners. And we also want to be disseminating these in media packets and using these at community events. We also produced a lot of print materials. We produced postcards and posters with QR codes to link to our website and to partner websites as well. In addition to the bus shelter signage that you saw, we also had posters and digital signage up for over 2 months in our rapid transit stations as well. We also brought half-page and full-page color ads and insertions for local newspapers that are widely read in these communities. Next slide, please. The other part of our multi-channel dissemination campaign included a social media campaign using Facebook, WhatsApp, and Instagram. We recorded public service announcements for use on local radio for Spanish-speaking and Haitian Creole-speaking communities. And of course, all the materials are featured in Spanish and Haitian Creole in addition to English. Next slide, please. We also are using a co-implementation strategy, and this is a short list of our CBO partners that will help us with access to our priority populations. You see a mix here of community and clinical partners. And on the clinical side, we have partnerships all the way from primary care to GI oncology specialists. Next slide, please. One of the organizations on the previous list is the Young Onset Colorectal Cancer Center at the Dana-Farber Cancer Institute, which is how we were able to connect to the wife of actor Chadwick Boseman, who was diagnosed with colon cancer at 39 years of age and died at 43. Dr. Jeffrey Meyerhart, co-director of the Colon and Rectal Cancer Center at Dana-Farber, Dr. Kimmy Eng, founding director of the Young Onset Colorectal Cancer Center at Dana-Farber, and Simone Boseman, Chadwick's widow, are featured in this photo. Next slide, please. We built that list of partners, and we will continue to build on it, because launching the communications campaign in 2024 was just the start of a longitudinal effort to reduce mortality from colon cancer over time with intentionality, sustained effort, and impact. Next slide, please. Thank you for listening. And again, I'm happy to take any questions that you might have. And I will turn it back over to Caitlin to introduce the new speaker.
And I can take the handoff. Hello, everyone. Nate Merriman, one of the GI physicians at Intermountain Health, and then also the medical director for GI and digestive health. I'm going to be sharing our story of the Intermountain Health inflatable colon. And I wanted to start off the conversation also with a share. So I think all of us are patients. And as being a physician and also a patient, I had my colonoscopy for screening 3 years ago. I had 7 polyps removed, and 3 of them were precancerous. I also have a family history of colon cancer in one of my grandparents. So I share that also because I think all of us are connected as patients or family members with someone we know who've had colon polyps or colon cancer. Next slide. So with that, I'll also say we have a lot going on. There are constant distractions in terms of social media, different channels that are on or off intermittently throughout each of our days. And then I think we need to continue to think creatively of how do we earn the attention of our patients, our families, and communities about healthcare and cancer screening. So that was part of the drive to try something new with colon cancer screening awareness. Next slide. So taking a step back, I joined Intermountain Health in 2020 during the pandemic in August. And in 2019, we had tried something new in Delaware with my prior team, where we had an inflatable colon set up in our perioperative services open house. It was an event for all of our caregivers and their families to learn about different aspects of the operating room, the endoscopy suite. And so I suggested, well, why don't we borrow an inflatable colon from Boston Scientific and put it outside the event? And with that, we had incredible engagement across generations. These are three of my kids, my two twins, one of whom was trying to remove one of the polyps, and I had to reassure the Boston Scientific rep that he was not going to pop the colon because he's a gastroenterologist's son. And as we learned with this, essentially an inflatable item in front of a surgical center brings a lot of attention, not only from people within it, but also people driving by. So multiple cars were stopping and families were getting out to check out this large inflatable colon that was sitting in front of our ASC next to the hospital. And I realized this is something that could really engage a lot of patients, families, communities across generations. And colon cancer screening matters to patients and families. So then I brought the idea to Intermountain Health in 2022 after we had come out of the pandemic, and we started small. You'll see it was not that small, but we learned fast, we iterated, we analyzed the results, and then our decision was to continue to scale this initiative. Next slide. So we had 4 core tenets of the colon tour. One is to simplify, standardize, and share content at each site. Our idea of starting small at Intermountain was 23 sites in our first year in 2023, where we shared content that was standardized, focused around what risk group are you? And this is content we got permission from the ASGE, from their department to share. It's very straightforward, a 1-page summary of helping patients and families to understand their risk for colon cancer. Step 2 was to support local team creativity and connection. This is actually, it was a unicorn that we had at Fillmore at one of our rural sites in Utah. And there was a unicorn that also appeared separately at Riverton Hospital, which was in Salt Lake. Separate unicorns, separate individuals, but really creative talent at each of our local sites that we encouraged, because our process was essentially core design with thoughtful adaptation, supporting our local teams to connect with their communities in the way they thought was best. Next slide. Step 3 was share human stories and data. I think this is critically important in healthcare, and it really resonated to have local patients with colorectal cancer sharing their story at many of the different sites. In addition to that, we shared local and national data. On the left here, we had different data elements that we posted at each of the sites to highlight why this is so important to spread awareness of screening. On the right, we connected an incredible, essentially research study with Dr. Rogers, whom I met through colon cancer screening and prevention nationally at the American Society of Clinical Oncology. And he put this picture of Utah on the screen, and I have learned a ton from Dr. Rogers. And one of these important points is we have hotspots for young onset colorectal cancer in Utah. And by sharing this with each of our sites as we traveled with the colon throughout the state, as I said, 23 sites throughout Utah and up into Idaho, it was amazing to see how this resonated, to really understand that we have some areas in Utah that we need to focus on, especially with young onset colon cancer. And the number 4 step was listen and learn at every site, and then connect the sites and the learning across sites to identify themes. And so we talked to patients and families and caregivers to understand what are the barriers to getting screened. And we even asked them about different ideas of how we could help address those barriers to support their communities in getting access to screening, but also increasing awareness. Next slide. So this is just a close-up of the colon. What would a talk from a gastroenterologist on colorectal cancer screening be without sharing pictures of the colon? This, of course, was the inflatable. We had colorectal cancer highlighted as well as polyp, and these descriptions we would highlight as we walked patients and families through the colon. Next slide. These are some of the data, but also the early elements of overview of our tour. I tend to think of it in terms of versions, much like the platforms and operating systems on our phones or computers. So version 1.0 was 2023. We started with patient-centered shared purpose, went across 23 sites in the month of March for colorectal cancer awareness in 31 days. Every site was a learning and improvement opportunity, and we got better and better throughout the month as we connected with our teams and said, okay, what did we learn from this site? How can we bring it to the next site to continue to get better? We partnered across service lines, hospitals, clinical programs, surgery and endoscopy operations, marketing and communications, and media. It was phenomenal, a team of teams approach. And then in version 2.0 last year, we did 26 sites in 31 days. We included hospital sites and 5 community events. And we had a colon tour blitz to spread awareness, as well as sharing easier ways for patients to get screened. One important point here is we didn't have funding to have our own colon in 2023, so we borrowed it from our partner with Boston Scientific. And then in 2024, we did justify the need, and we purchased 2 inflatable colons for Intermountain Health that we're now sharing across our sites. Next slide. So these are a couple of pictures in the colon. On the left, that was me with one of our morning TV show hosts, and then one of my teammates, Taryn McCormick, who's a phenomenal advanced practice provider I work with. And then on the right is the inflatable colon outside the Utah Tech baseball game in St. George. They did not let us take it on the field this time, though they said they would consider that in the future. And we had an unbelievable story from one of our patients in St. George, and she threw out the first pitch of the game. Next slide. So 5 colon tour takeaways. Share the why, start with patient-centered purpose, one site at a time, support and empower each local team, connect the sites, share ideas, best practices across the sites and system to continue to learn faster together, simplify and standardize the content, and encourage local creativity. That was key to really support local teams and sharing what was important to do to them in a way that made sense to their community. And then measure the impact. We had 574 media stories on the colon tour in local, regional, and national media. We increased colon cancer screening with colonoscopy 17% in year 1 after the tour across our Intermountain sites in Utah. And in 2024, we had over 10,000 attendees at the 26 colon tour events in March. Next slide. And last couple slides, we will keep experimenting and learning. This was us taking the colon on tour to the Real Salt Lake soccer game. This was my wife on the left, my son Ryan. I recruited them to help, and several of our teammates, Priya, Dave, Taryn, Aaron, and I. And we will continue to bring the colon to different sites, including a rugby game in 2025. And we're excited to continue to learn and spread colon cancer awareness and increase screening across Utah and all of Intermountain Health. Next slide. And I wanted to say thank you to everyone on this panel team with me, but also on the webinar. Continue to work together to improve colorectal cancer screening and prevention. And with that, I'll hand off to my teammate, David Russo. Over to you, David.
Hello, thanks, Nathan. And thank you to the NCCRT for having me here today. Again, David Russo, I'm the Executive Director of Cheeky Charity, and I'm here to talk about our outreach efforts to the LGBTQI+ community. So what we're going to be talking about, well, the first thing is Cheeky Charity. What we are, if you click again, we focus on both colorectal and anal cancer. And we do both awareness and education, as well as support for patients, survivors, and their caregivers. So the big thing is why are we reaching out to the queer community? And I mean, if nothing else, we are a large community that is able to be reached out to. And I say we're increasingly more visible, where 21% of the Gen Z population identifies as somewhere on the spectrum. And we have our unique struggles. Between 15 and 20% LGBTQI plus adults avoid healthcare because of fear of discrimination or poor past experiences. And we have additional risk factors such as minority stress, which is additionally compounded with folks that are already in marginalized groups. And lastly, I like to say that we're a good community to reach out to because we are loud, we're passionate, we're interconnected, and we really want to help each other. So it really makes it easier amongst this community. Click again. The approach that Cheeky Charity takes is multifaceted. I think the one that is the most glitzy is our Pride festivals, which I'll tell you a bit about. But the Pride Festival is kind of just one touch point in the grand scheme of a year-long effort. In tandem with that, we try to partner with community organizations. We focus on LGBT centers because they're kind of like a core hub in any community for the queer community. But then there's also, like, if you think creatively, like there's gay sports leagues, there's other health advocacy organizations, whether it's focusing on, HIV, trans health, or other minority groups that have a component of, LGBTQI plus support. And then other local awareness events like health and wellness fairs. And then the other stuff is things that we do kind of amidst those groups. And then if you click again, the other big thing is to work with your other cancer advocacy organizations. And so we've been tremendously grateful for the support from organizations like the C4, ACS, Fight CRC, Colon Cancer Coalition, the CCA, Colon Cancer Stars, Man Up to Cancer, the Blue Hat Foundation, Butt Check, and more. So I think that bringing everybody in to work together has been just incredible and really made us be successful. So if you click again, when I say that there's a lot of Pride festivals, I'm not joking. I mean, we're actually monitoring over 1,000 Pride festivals this year, just in the US alone. And so if any organization would like help to have a presence at their local Pride festival, we probably know about it. We probably know all the details about what's involved, what the registration costs are, and all the other details. So we're happy to help in any way we can. And also, hopefully, we're going to have a presence at your local Pride festival also. So that would make it even easier for us to help out. All right, if you click one more time, so in 2024, this was our first year kind of going out into the national community and trying to have a presence. And we got into over 20 Pride or LGBTQ focused events, and they're pretty dispersed throughout the country. This year, we are expecting to be in over 100. So if you click again, so like I said about the Pride festivals being one touch point, here's a map of over 350 LGBT centers that are dispersed across the country. And so for any Pride festival that we're going into, it's like, okay, how do we work with the LGBT center to say, we're going to tell a lot of people about colorectal cancer at this event, but we want to continue it and build off the momentum. So can we do a webinar with your community, or can we table before or after some of your big events where you're going to have a lot of community members there anyway? Or can you help us get connected with other community organizations and set up an additional event with their groups? And a lot of it starts at the Pride Festival. And then, so you have the Pride Festival, the LGBT Center, and then on the right hand of the screen is the FQHCs. And there's a lot of FQHCs that have a focus on our community. I listed a few here. And working with those medical centers that are the kind of the central hub or the first step in the healthcare process for a lot of folks that ultimately get their colorectal cancer screenings. A lot of the emphasis should be on how do we help them, because they're overwhelmed, focusing on every facet of healthcare for our community, to let us help them with their colorectal cancer screening requirement to build up their screening rates within their groups. And that we've seen success in that. And I click one more time. All right, so here's where I don't feel a need to, but I'd like to have a disclaimer that says, Cheeky Charity, we use humor to talk about colorectal cancer. We understand the seriousness, obviously, of this disease. And that's partially why we feel a need to find ways to facilitate conversation. We have the quote, by making the uncomfortable approachable, we create space for effective awareness and action. And the next slide actually shows a little overview to say, doing something cheeky, having something playful is not the hard part of the work we do. What's hard is actually then saying, okay, I have somebody's attention, or I've let that person let their guard down because we've said something funny, or we've shown them something like that looks like a butt. And how do we now start that conversation about colorectal cancer, say something to them that will stick into their heads, and then get them to take action, whether that action is to tell somebody else about colorectal cancer, to go in for their screening, or to follow up on if they had a positive Cologuard or a FIT test, to then go in for the follow-up colonoscopy. That's really the challenging part. And that's what I see as the sweet sauce to being effective in this world of advocacy that we're doing, focused on the queer community. Next slide. So here's the cover and the front and back of one of our flyers about colorectal cancer. So it's let's talk about butt stuff. And if you click on the next slide, we get into what the differences are between colorectal and anal cancer. So you could see, what's going on with each of them and what are the differences. Because in our community, they might hear something about both, but not know what the differences are. And it's in a package that is friendly looking and is something that people want to see. So I have to jump through the next set of slides really, really fast because I'm pretty much at time. This is the New York City Pride where we had a booth. And if you click one more time, I might kind of end with this. Yeah, you play that video real quick. It's just to show you, we had an inflatable colon at Palm Springs Pride, and we turned it into more of a party. And there was so much of a backlog that people were forced to stay in the colon for a good amount of time and look at the things around it, look at the information about colorectal cancer and Crohn's. And then we even had people being able to sign a butt wall at the end of it. We had over 5,000 people go through the colon in 2 days. It was phenomenal. And we, if you click, I think twice, actually try to get past this slide. This is me as the mascot. And then the last thing I'll leave with is actually commit to your colon pledge. So this is something we had people do in exchange for the opportunity to win a bidet, where they can fill it out, and they give us their contact information, and we tell them that we're going to notify them when they're due for their screening. While they gave us their contact information, mostly if they won the bidet, it is really helpful for us to be able to follow up and reach out. You can click through the next set of slides, and I would just say there's a lot of other stuff that we've done. Oh, thank you for jumping there. So the last thing, what we want to follow up with is get into more implementation science and really analyze what we're doing and how we can do it more effectively. And we have a whole bunch of programs, which if anybody's interested, please reach out to us. And I'd love to talk through what else we have going on. With that, I am super excited to pass this on to Jamie to continue this amazing webinar.
Great. Thanks, David. Good afternoon, everyone, and thank you to NCCRT for having me today. I'm Jamie Thompson. I'm a senior research associate at the Kaiser Permanente Center for Health Research based in Portland, Oregon. Today, I'm going to be talking about the work that we did with some tribal organizations to create tailored messaging about colorectal health for American Indian and Alaska Native communities. So next slide. And I'd actually like to kick things off by sharing one of the live action videos that was created as part of this work.
My name is Arinda Goddard. I'm a member of the Confederate Tribes of the Chehalis Reservation and granddaughter of Mel Yukton. This is my uncle, Percy Yukton, former leader of the Chehalis tribe. He passed away from colon cancer in 2002. Back then, we had never heard of colon cancer and didn't know there was something we could have done to prevent it. By the time the doctors diagnosed him with late stages of colon cancer, it was too late. Now I often think about the extra time we could have had with him if he was screened earlier, possibly years. Our time here is precious and shouldn't be taken for granted. So please get screened for colon cancer and encourage your families to do the same.
Great. I don't know. Thank you.
Most people diagnosed with colorectal cancer have no obvious symptoms. That's why we recommend screening starts at 45. I got screened.
I'm home.
Grandpa, did you know that colorectal cancer is one of the most common cancers in the whole country? And it's one of the most common causes of cancer deaths.
Very interesting, Talcosia.
It's true.
You seem concerned.
Not for me. It mainly affects old people. Grandpa, are you more than 45 years old? It's a cancer you can prevent if you get screened early.
I don't even need to start with a colonoscopy.
There are poop tests you can do at home and mail to a lab.
You're gross.
But smart.
That's true.
It's important to know our family's history.
Wait, what is our family history of colorectal cancer?
I don't know.
Grandpa, you should do the test. Do it for us.
You know what? Anything for you.
Thank you. So these videos were part of several live action videos that were created as part of this project. And so support for this work came from the National Association of Chronic Disease Directors. This was funded by the CDC, and it was a partnership between several organizations, and our Kaiser Permanente research team led the community engagement work to conduct the listening sessions with the tribal organizations. Next slide. So specifically, the project was focused on creating tailored messaging and materials to promote colorectal health in American Indian and Alaska Native populations. We had the opportunity of working closely with 2 CDC-funded tribal organizations that had an interest in participating in this work. So specifically, the Great Plains Tribal Leaders Health Board, headquartered in Rapid City, South Dakota, and the South Puget Intertribal Planning Agency in the Pacific Northwest in Washington State. So at each site, we conducted in-person listening sessions, followed by 2 virtual calls. In general, we had about 15 to 20 participants between the ages of 45 to 75 participate at each site. And we worked together to learn about messaging, themes, and concepts that help motivate American Indian, Alaska Native community members to get regular colorectal screenings. And additionally, one of the final deliverables for this work was an implementation guide. Next. So the listening session focused on 3 core components: listen, empower, and co-create. So for listen, it was really about learning about local barriers and gaps in care directly from the community members. For empowerment, it was about sharing health information with the community participants in a collaborative way. And then finally, if we're co-creating, we work together to develop messages and materials that resonate with and motivate community members to take control of their health. So it was a really flexible process. It's meant to be tailored to the community that you're working with. The figure below shows the general format. So it was an in-person session that included presentations, small group work, and brainstorming, and then follow-up virtual sessions to review and refine draft messages and materials. Next slide. So some of the key learnings were using a multi-generational approach by including grandchildren and elders in the messages and materials, as you saw in the video earlier, and really ensuring that materials are relatable and culturally relevant by incorporating local cultural imagery and traditions. So the Great Plains Tribal Leaders Health Board really wanted to focus on including Lakota words to reinforce cultural identity, using visuals for colon health education, buffalo imagery, local statistics, and then incorporating details about healing traditions. The other tribal organization that we worked with, SPIPA, they recommended highlighting traditional foods, fishing, medicine wheel colors, intertribal milestones like the canoe journey, and also incorporating water as a symbol of spiritual healing. Next. So I'm going to just briefly highlight the types of materials that were developed. I also want to take a moment to share that these materials were recognized by the American College of Gastroenterology and won the 2024 Scopie Award for Best Initiative Serving American Indian and Alaska Native populations. Next. So we co-created visual stories, a nod to the role of storytelling in American Indian and Alaska Native culture. We had message cards for distribution at community events, clinic posters, and then also a series of videos. You saw some of the live action ones earlier. The live action videos were really meant to share stories and motivate people to get screened. We also had some animated instructional videos on how to complete fecal testing and what to expect before, during, and after a colonoscopy. Next. So the dissemination strategies for the print and digital materials, it varied by site, but it typically included mailings, in-clinic distribution through Good Health TV in the waiting room areas of the Indian Health Service facilities. We also through websites, conferences and meetings, social media, and community outreach events. And there is discussion now for some potential mainstream distribution through local or national TV and streaming services. Next slide. So fine, I mentioned the implementation guide earlier, and I just wanted to take a moment to share it with everybody. We did this in collaboration with NACDD. The QR code is here, and this guide includes the listening session format with Listen, Empower, Co-Create, how to conduct a listening session. It highlights the different partners we worked with the Great Plains and South Puget Intertribal Planning Agency, and there's some resources in the guide as well. Next slide. And so this, just to wrap up, this website showcases all of the materials created for this project, and you can check it out at kpchr-engage.org. And yeah, I think we might be 2 minutes ahead of schedule. So thanks everyone for your time, and I will pass it back to Emily.
Excellent. Well, thank you, Mark, Dr. Merriman, David, and Jamie. These were wonderfully inspiring presentations, and from the engagement in the chat and question asking, it's clear that our participants are already starting to think about how they might be able to take some of these strategies and apply them in their settings. So given the exciting response we received to this webinar, we had over 400 registrants and more than 250 of you joining live. We wanted to be sure to gauge your interest in future programming on colorectal cancer public awareness strategies, since there's clearly a lot of interest in this area. So please take a minute to select the top 2 topics that you're most interested in learning more about from the list below. And we'll give you just a moment to think about that. It looks like we have several responses, and there's a lot of interest around more sharing around best practices at community events and with patient populations, as well as interest across the board. So we'll put our heads together and think about what we can do for future programming. Thank you for sharing. So with that, we'd like to take, we have about 10 minutes to take questions from the audience. I have a few that were already shared through the Q&A box, but it's not too late to submit. So please type your questions in the Q&A box and we can ask a few questions of our speakers. So the first two questions I have are for all the speakers. The first one is, do you find that incentives with the marketing messages and strategies help increase screening? So incentives for people in the public or patients. Would any of you like to share around that?
I can come off mute, Emily. Can anybody hear me okay? Incentives is an interesting concept, and we've got a health center in the city of Boston that works with the Colon Cancer Coalition and Exact Sciences, as a matter of fact. And what they do is slightly different than the traditional, gift card to the supermarket, whatever have you. What they do is they engage people to do the first, of course, of what David wonderfully articulated as the two-step process. Get the screening, and then depending on what your either FIT or a Cologuard test tells you, you have to take step 2. What is happening at this particular health center is if you do have a positive result from a FIT or a FIT DNA, they cover the cost of all of the materials that you need to prep for the colonoscopy. So when you're talking about targeting particular populations where resources or incomes are limited, this creates a transition from phase 1 to phase 2 in terms of the screening, and it allows for the additional support and engagement between the patient and the community health center. So using the money for that purpose, it's probably at or around the same as a traditional gift card, but it's the specific use and the ability to continue the engagement and the and these conformance, if you will, to be sure to go to the second phase. I think is absolutely helpful. They happen. I think I mentioned in my slides that the overall rate of colorectal cancer screening in Massachusetts is somewhere around 43-44%. This particular health center is screening at 73% of their eligible patients.
That's phenomenal. Jamie, David, or Dr. Merriman, have you either used incentives with your public awareness or thought about it?
So, yeah, I mentioned the bidet giveaway, and we had costs like gift card incentives in exchange for taking part in educational sessions as part of a work we were doing with the New York State Department of Health. And it's been successful. I would say just like to a point, like it's not gonna get that person, in for the colonoscopy per se, but it could get the light bulb turned on or get a seed planted. Is what I've seen, but I also don't work with a large enough population to maybe have good results. I'd pass it on to Jamie or Nathan.
Yeah, thanks, David. So I'll say that, I work with Kaiser, so I have the opportunity of working with a lot of different FQHCs and safety net settings throughout the country. And I will say that financial incentives, there are generally, I would say there are mixed results. It really depends on the organization, on the community, the way they're doing the outreach. So I think it can be very effective, but I think, again, it does really vary on how the practice is done and if it's a sustainable practice in offering incentives and how that whole, Mark mentioned earlier, just getting people sort of through that entire screening pathway. So I guess this isn't a great answer, except I think it depends. It depends.
And I can echo that. We partner with Select Health, which is our insurer at Intermountain, and I think they cover about 35 to 40% of our population. They've had some mixed results, and they've definitely experimented more with incentives. If I'm being honest, one thing it'd be great is to have insurers help to make it easier to get to and from the colonoscopy, to get the prep for free, always paid for. And I realize those are maybe non-traditional incentives in terms of it's not a gift card, but to make it just easier to get all the steps done, I would love insurance companies to do at scale, personally.
That's great. Well, we have a few health plan members, so hopefully they're in the audience and listening. Great. So on to our next question. One of our participants asked if any of you have experience with public awareness or screening in unhoused populations. Okay, well, this is something we'll try and aim to bring focus to that in future programming. Next up, we have a question here, which could apply to any of you. How are you thinking about blood screening tests' role in colorectal cancer screening? So potentially, responding if there's public interest, or, talking about the new tests that are coming onto the market.
I guess I can start with that one. I get this question every week. I think I'll say my personal opinion is it's very early. I think that the testing needs to be a little better in terms of sensitivity in particular, if we're talking about blood tests. That being said, from a patient perspective, so much easier to get a blood test than a stool test than a colonoscopy. So I think there's future value potential there, but I think it's on the early side based on what I've seen.
Yeah, well, unless anyone wants to share further, I'll also mention that our annual meeting back in November, we hosted a session around all of the currently available colorectal cancer screening test options, current and emerging, and covered some of the information that we do have around blood test options. So those slides are available through our website. So we'll include that in the links that we share in our email wrap-up that includes the evaluation link. So we'll be sure to add that. Good question. Next up, are there any videos in Spanish that each of you either had through your organizations or would recommend from other organizations to share with community health workers or the community that might be Spanish speaking?
Well, as I mentioned in my comments, I certainly have video, recorded PSAs, audio only, written materials in Spanish that relate directly to our campaign. Anybody that's interested in having access to those, just feel free to reach out to me.
And I can also add that we do have a lot of Spanish videos. You can check it out. I can drop into the chat the website, but we have in Spanish a lot of instructional videos on how to complete fit testing. So the Ensure and OC Micro. We also have Spanish videos on what is a colonoscopy, what to expect before, during, and after, and also about bowel prep. So there are a number of videos that we have on our site.
Great, and there are a number of your resources available through the American Cancer Society, so we can follow up with some of those as well. And I'm just scanning the chat to find our next question.
And Emily, as you're doing that, I'll just say that if there's a similar question or interest in materials for Haitian Creole, please let me know.
Okay, excellent. And let's see. There's a few questions that we can quickly answer with links in our email wrap-up, so I'll do that. But taking one last question, somebody shared that January was Cancer Awareness Month for first responders and firefighters. 75% line of duty deaths, according to the IAFF. Are there any specific incentives or best practices forthcoming for this population? And I will share that I don't think that we've had a focus on this through NCCRT as of yet. I know the larger American Cancer Society has, so we'll see what is available and included in our wrap-up email. But do any of you have experience or best practices to share for those populations?
Well, a little bit here from Boston. If you think about not just colon cancer, but a variety of other different cancers, and the one that really raises to the top of my mind immediately is cancers related to the lungs. The guidelines don't really lend themselves to the way that people that are looking at occupational or first responder or other types of issues, would need. because I think their exposures are very different than people that are sort of just, everyday folks, if you will. So what has been done here in Boston is that there's been a purposeful sort of strategy relationship between our Boston Fire Department and, again, one of our local comp cancer centers, which is the Dana-Farber Cancer Institute, to basically create a program where they're actually screening people that are first responders for a variety of different cancers off what I like to call off script. So in other words, the guidelines don't say that this is supposed to happen, but we know that your risk is unique and different. So we're just going to do this, right? It's been in the works for some time. They just started doing it last year. And I wasn't directly involved, but I've had a lot of my first responder friends express a very high level of gratitude for someone finally making some effort to look at what they do on a day-to-day basis and begin to help them understand the impact that it's had on their bodies.
Thank you for sharing that. That's exciting to hear. So I think we've come to the end of our time that we have for questions. There's a few more in the chat. And again, I'll follow up by email with everything that we can, as well as additional links. But please don't go yet. I have just a couple more short slides to share with you. So first, I'm really excited to share that just today, we landed on a date and time for our annual Colorectal Cancer Awareness Month webcast. It's going to be March 12th from 2 to 3. We'll be sharing a sort of high-level landscape view of where we are with colorectal cancer screening and incidence and mortality as a whole, as well as placing a focus on our 80% Every Community National Achievement Award honorees, which will be announced in early March. We always learn so much from their successes and best practices and look forward to digging in with them to learn about their work. So there should be a link in the chat. Please, we encourage you to register, share it with any partners and colleagues that you think might be interested as well. And then on to the next slide. And we also want to hear what activities you have planned for March. So you have an opportunity to share your events, resources, and opportunities for others to get involved in this March. We'd love to highlight any recent resources, events, whether they're virtual or in person, generally things that are free or perhaps a fee is associated with a conference. But please submit those through the link in the chat. We're accepting them through February 19th, and then we'll be sharing them in our newsletter, CRC News, in late February or early March. So please keep an eye out for that. And also, if you somehow came upon the link to register for this webinar and you're not already receiving our newsletter, if you go to our homepage and scroll down to the very bottom, you'll see a place to input your email. Our newsletter comes out about every 2 weeks, and you'll find out about new resources and programs through NCCRT, as well as those of member organizations. Next slide. And so with that, I want to share another huge thank you to our presenters. We learned so much from you and really found your presentation so inspiring. We learn a lot from all of you who attend as well. So please follow the QR code or the link in the chat to fill out our evaluation survey. We take your advice very seriously and look forward to future programming around public awareness. So thank you again, everyone. Have a great rest of your day.